Every day, something dramatic happens in the Caribbean that affects our lives. We'll give you the details. We'll give you the facts on Caribbean Perspective with Eddie Frederick. Here's Eddie Frederick.
So glad you can join us. The Centers for Disease Control, CDC, in the United States has eased the restriction on wearing masks for fully vaccinated people. This story takes the lead in our 1113th edition of Caribbean Perspective for Monday, 17th May 2021. Details after this break.
Hubbard's big promotion is back. Live free for 1 year. Spend $50 or more in any Hubbard's department and receive a chance to win big prizes every month. Property or vehicle insurance for 1 year. Free internet, cable and data for 1 year. Free fuel for 1 year. Free cooking gas for 1 year. Free electricity for 1 year. Free drinks for 1 year. Extra cash account and the big free groceries for 1 year. Promotion runs from April 1st to September 30th, 2021. Live free for 1 year with Hubbard's in association with Solgas, Flow, Grenadian General Insurance, Carib Brewery, Coca-Cola, Grenada Bottling Company, Grenlec, Communal Cooperative Credit Union, Dutch Lady Milk, Promo, Danny and Supreme. Terms and conditions apply.
Welcome back. The mask-wearing ease by the CDC in the United States for fully vaccinated people relate to outdoor crowded settings and indoor, among others. More in the CBS News report.
The president called this a major milestone, and it comes amid mounting evidence that fully vaccinated Americans are highly unlikely to spread the virus even indoors or in large crowds, and so therefore they can stop wearing these and they can stop social distancing.
This recommendation holds true whether you are inside or outside.
President Biden hailed the new development in the Rose Garden.
And you can shake hands. You can even give each other a hug.
As the First Lady celebrated with a newly maskless crowd in West Virginia.
We just learned it as we got off the plane, and here I had gone out to buy one that was coordinated with my outfit, so...
The CDC says the updated guidance is based on new data about the powerful protection the shots provide. With nearly half of U.S. adults now fully vaccinated, new daily cases in the U.S. have dropped by a third just in the past 2 weeks, the lowest rate since last September.
St. Lucia and other OECS territories, on the other hand, do not have that luxury, especially as most of the population has not been inoculated. HTS's Stanley Lucian reports.
The latest guidelines issued Thursday by the United States Centers for Disease Control and Prevention, CDC, on its COVID-19 protocols came as a pleasant surprise to many Americans. Here in St. Lucia, medical professionals have also been reacting to the announcement. The president of the St. Lucia Medical and Dental Association, Dr. Merle Clark, says as enviable as this development is, St. Lucia is some way off making such an announcement.
Can this be replicated here necessarily? The answer to that, we believe as an association, is no. We are not exactly in the same place as the US is. In terms of vaccination, the number of vaccinated individuals or the percentage of the population which is vaccinated is significantly higher than here, for one. What we do know about vaccines is that they certainly reduce the risk of contracting COVID-19. And if somebody were to contract COVID-19, that certainly reduces the risk of serious illness, hospitalization, and death. And that is important and that is significant. What is unknown is the risk of transmitting COVID-19 if you were to have it being a fully vaccinated individual. And we'd like to say here, importantly, that fully vaccinated means 2 weeks after you've gotten the second dose of the vaccine, or the two shots schemes. Johnson & Johnson really is the only one thus far, which is just one shot.
The director of the CDC, Dr. Rochelle Walensky, said, quote, "If you are fully vaccinated, you can start doing things that you had stopped doing because of the pandemic," unquote. U.S. President Joe Biden welcomed the development, stating, quote, "We have all longed for the moment when we can go back to some sense of normalcy," unquote. In St. Lucia, former Chief Medical Officer Dr. Stephen King says there are lessons to be learned from the latest CDC position on the protocols.
In this whole COVID-19 management, we're talking about really risk assessment and risk management. And you got to look, each person and each country has to look at their own risks and design their strategies to maximize safety of individuals and the population. Now, the CDC is basing, the science is showing us that vaccinated people have a reduced chance of transmission. So there's a reduced likelihood of transmission from vaccinated people. And further, vaccinated people are protected from getting severe disease. So those are two hard scientific facts that they're using to guide their policy recommendations. Also in the United States, you'd appreciate that 60% of American adults have already received their first dose, and 35.8% or so are fully vaccinated. So America is way ahead in terms of vaccination as compared to the Caribbean and, of course, St. Lucia.
The relaxation of some of the COVID-19 protocols by the United States Centers for Disease Control and Prevention is, in some sense, a reward to the American society for trusting science. Though the United States has not attained herd immunity, the high and growing percentage of fully vaccinated people mean that the health authorities are confident that measures like mask wearing outdoors for those inoculated is no longer seen as necessary. Stanley Lucien for the HTS News Force.
Trinidad and Tobago records 21 additional COVID-19 deaths, pushing the death toll for the month of May to 87. More in this TTT News item.
The Ministry of Health is also reporting 397 new COVID-19 positive cases. Comprising the deaths are 5 elderly females with comorbidities, 1 elderly female without comorbidities, 3 middle-aged females with comorbidities, and 3 middle-aged females without comorbidities, as well as 4 elderly males with comorbidities and 1 elderly male without comorbidities, 2 middle-aged males without comorbidities, 1 middle-aged male with comorbidities, and 1 young adult male without comorbidities. According to the latest update, the 387 positive cases reported today, Thursday, reflect samples taken during the period of May 9 to May 12 and not the last 24 hours. Total active COVID-19 cases now stand at 4,814, with 342 patients at hospital. The Ministry of Health is urging everyone to follow all personal health guidelines to avoid becoming infected or spreading the virus.
You're listening to Caribbean Perspective with Eddie Frederick.
More beds added to Farrell healthcare system. Minister urges citizens to get vaccinated. TTT's Terrian Brown Campbell reports.
As the daily COVID-19 death and infection rates continue to increase, the Ministry of Health has moved to provide additional space to treat persons who have contracted the virus. Minister of Health Terence D. Alsing toured the Point 14 facility on Thursday and outlined the care expected to be given at each of the units.
With these type of facilities at UTT campus in Valsayn, DB, and here, we can add now 130 beds to the hospital grid. What that means is that our occupancy rates will drop significantly. It also means that we can have more space at our secondary and tertiary hospitals.
The health minister cautioned, however, more treatment facilities will not solve this country's current COVID-19 crisis.
That adding more physical beds is not the solution to this pandemic, because there is a limit to not only physical space, there is a limit to the human capacity. The nurses, the doctors, the lab techs, everyone. So the solution to this acute phase of the pandemic, again, is for the public to exercise extreme personal responsibility.
The step-down, step-up facilities at Valsayn, Debe, and Point 14 will provide transitional treatment for COVID-19 patients. Meanwhile, Minister Dialsing again urged the population to get vaccinated.
Hopefully by the end of next week, we'll be rolling out the Sinopharm vaccines. We'll have 100,000. That means it's a 2-shot vaccine, just like AstraZeneca. We are negotiating, and this is no secret, with Sinopharm to bring in commercial quantities. Commercial quantities mean in the hundreds of thousands.
Minister Diyal Singh noted the vaccine rollout will soon be entering its third stage, vaccination of the general public. Terry Ann Brown-Campbell, TTT News.
There is a prediction that tens of thousands of doctors and nurses will be needed to manage intensive care units in Latin America and the Caribbean. Details in this Barbados Today online report.
Director of the Pan American Health Organization, Dr. Caricia Etienne, revealed that nearly 80% of intensive care units are filled with COVID-19 patients, with the numbers even more dire in some places. She said the rise in hospitalizations as a result of the virus means that health workers are working overtime and juggling more responsibilities as they manage more patients now than at any other point in the pandemic.
PAHO has helped deploy 26 emergency medical teams across 23 countries in the Americas to provide specialized care where it is most needed. Also, some 400 emergency medical teams and alternative medical care sites were set up, helping our countries expand their capacity with over 14,000 new hospital beds and 1,500 more intensive care beds. But based on how COVID is spreading, we estimate we'll need 20,000 doctors and more than 30,000 nurses to manage the ICU needs of just half of the countries in Latin America and the Caribbean. Our health workers are also facing mounting challenges as the life-saving supplies that they rely on, like oxygen, are running dangerously low.
In the meantime, health officials in Guyana are reporting that more young people are becoming seriously ill from COVID-19 than before. Gordon Mosley of News Source Guyana reports.
The spread of coronavirus across the country remains on the increase, with another 186 new cases recorded in the past 24 hours, along with 2 more deaths. There are now more than 1,800 active cases in the country, with 111 persons hospitalized with the virus. The health minister, Dr. Frank Anthony, today revealed that while in the early days of the pandemic, its fatal impact was mostly felt by the elderly, that has since changed, and more younger people are turning up at the hospitals in serious and sometimes critical conditions.
What we have noticed over the last couple of weeks is that we have seen a change in the mortality patterns, because we're seeing persons who are between 50 and 40. We've seen quite a few cases in that age category. We have had a few cases in the 40 to 30 age category, and we have had about 3 cases in the 30 to 20 age category.
The minister said the vaccination of the elderly population might have resulted in fewer deaths for the older group. He said younger people need to take more responsibility for their actions and get vaccinated, since it appears that they are not being spared from becoming critically ill.
Did you know that your friends and family can now shop at the food fair from anywhere in the world, and you can receive here in Grenada? The food fair and GrenadaMarket.com now makes it possible through secure online shopping and personalized customer service. Simply send your loved ones a list of your preferred items or let them fill an online basket, and the items will be available for pickup or delivery. Visit GrenadaMarket.com or thefoodfair.gd today for more details. The new norm. Spread the news.
I am Eddie Frederick. This has been Caribbean Perspective, a whole new approach to highlighting developments in the Caribbean. In the meantime, please continue to log on to CaribbeanPerspective.com for more daily news and more.